Hey, what's up, everyone? Nurse Jar here. Welcome to my YouTube Nurse Aide training channel. Guys, it is 2023. I'm so excited. Hey, listen, if you have not yet subscribed to my YouTube channel, please go ahead and kick that subscribe button. Hit the like button on this video and any other video that has been helpful to you. And if you like to be notified whenever I upload new content or whenever I go live, go ahead and ring that notification bell. So, as promised, I am coming at y'all with new updated videos. Okay, so I already uploaded a new video for 2023 for the opening procedures. Again, it doesn't matter if you're testing under Pearson VUE, Credentia, PROMETRIC, or Headmaster. Your opening procedures are basically going to be the same. Okay, so take a look at that video if you have not. Okay. In this training video, I'm going to be demonstrating and giving step-by-step instructions on how to perform the PROMETRIC testable skill, partial bed bath, and back rub. But before I get started, I just want to cue you in on 4 of the most common forgotten steps in this skill, okay? So the first most common forgotten step is drying the face, right? So after you wash the face with water only, don't forget to dry the face with the towel and you'll pat dry, okay? The second most forgotten step is the removal of the gown. The third is the placement of the linen protector, and you have to use a towel for the linen protector, not a chucks, okay? And then the fourth most common forgotten step for this skill is the removal of the linen protector. So let's go ahead and get started. Okay, so with PROMETRIC, you will have to perform the opening procedures. That is greeting the resident, addressing the resident by both name and title, introducing yourself by both name and title, and explaining the procedure before each individual skill that you perform. Now, just a couple of tips for you, okay? There's not going to be an actual door, so when you knock, you can either knock on the overbed table or the footboard of the bed. Also, the call light is going to be a jump rope, okay? And I'm just going to walk over here real quick. For PROMETRIC, the call light will be hanging over the headboard, okay? So if you don't see it anywhere, make sure you look over on the headboard, okay? Because that's where they will normally place it, all right? Okay, so let's go ahead and get started. Hi, good morning, Mrs. Jones. How are you? Awesome. My name is Julie. I'm your CNA, and today I'll be giving you a partial bed bath and back rub, okay? All right, Mrs. Jones, before I get started, I just want to make sure your bed is in a low safe position, and it is. Your bed wheels are locked. I'm going to go ahead and give you your call light. It's right next to your hand, and I'm going to provide you with privacy. Mrs. Jones, before I go wash my hands and gather my supplies, is there anything else I can do for you? All right, Mrs. Jones, I'll be right back with my supplies. Washing hands. All right, guys, so what I've done, I've moved the overbed table close to where the supplies are, okay? Remember, this thing has wheels, so you could move it around to wherever you need it to be, okay? Now, for this skill, partial bed bath and back rub, you will need to collect 14 supply items, okay? That's 14 supply items. I'll usually collect my supplies in the order in which I'm going to use them, okay? So the first thing that I'm going to collect is a chucks pad, which I'm going to use as a protective, or not a protective barrier, but a clean barrier over my overbed table, okay? So that will be the first supply item I collect and place on the table. The next thing that I'll collect, which will normally be in, let me move this out the way, in the nightstand, will be a wash basin, lotion, and soap. And then I'll collect my privacy blanket. I'll collect my gloves. You'll just need one pair of gloves. And I guess I'll put these gloves on top of my privacy blanket. 2 towels. 5 washcloths. Going to be 1 washcloth to wash the face, and then you'll need your second washcloth to wash the behind the ears, the neck, the torso area, the flanks, 1 arm, hand, and underarm, and then the third washcloth will be to rinse those areas. The 4th washcloth will be to wash the back of the neck and the back, and the 5th washcloth will be used to rinse those areas. Okay. The second towel you're going to use as a linen protector. You do not want to use a Chuck's pad as a linen protector, okay? So make sure you grab 2 towels. So again, all together, I have 14 supply items. And what I normally, or how I normally train my students to do, is to count the supplies as you are getting them, or you can wait till you get back to the overbed table where you have all your supplies set up and organized, and then count. So I have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. I forgot something, right? What did I forget? Yes, the clean hospital gown. Yes. So that is why it is important, okay, for you to know how many supply items you'll need to collect, because as you notice, when I counted, I only had 13 items, but because I knew that I needed 14 items, I knew I was missing something, okay? And hopefully y'all were able to help me out, right? To tell me that it was a hospital gown that I forgot. So the point that I'm trying to make, guys, is that it's really important for you to know how many items you will need to collect, because it will cue you as to whether you forgot something or you collected too many items. All right. So this is it. 14 supply items, 1 wash basin, 1 pair of gloves, a privacy blanket. You can either use a bath sheet or a hospital blanket, 2 towels, 5 washcloths, a clean hospital gown, soap, and lotion. All right, Mrs. Jones, I have all of my supply items. I just need to go fill the basin with some water, and I'll be right back, okay? Okay, so now that I've made it back to the sink, I am going to fill the basin with moderate temperature water. So if your sink or faucet has 2 handles, you'll want to turn on both handles. If at the test site the sink has only 1 handle, you'll turn that 1 handle to the center setting. The Nurse Aide evaluators are not going to have a temperature to test the water temperature. They're going to be watching to see if you turn that 1 handle to the center setting, or if the sink has 2 handles, you turn on both handles. So that's what I'm doing right now. Okay. Now, while you're at the sink and the water is running, you can go ahead and test the temperature of the water now, or you can wait till you get back to the bedside. If you're testing it at the sink, or whether you're testing it at the bedside, make sure you verbalize doing so, okay? I'm testing the water. Okay, now that I have my basin filled, I'm going to head on back over to the bedside. All right, Mrs. Jones, I've already tested the water. It feels good to me. Now I would like for you to test it to make sure it's a comfortable temperature for you. All right, so at this time, the nurse aide evaluator will usually speak for the mannequin. If they do not, don't stand there waiting for the evaluator to speak, okay? Just act as if the resident said that it was okay and continue on. It feels good? All right, Mrs. Jones. All right, the next item that I have are my gloves. But before I put my gloves on, I'm going to go ahead and just get the call light out of the way. PROMETRIC is big on body mechanics. So if you need to raise the level or height of the bed to a comfortable working position for yourself, you'll need to do so at this time, okay? All right, Mrs. Jones, I'm going to go ahead and just place your call light here. I will give it back before I leave for the day, okay? I'm also going to raise the bed to a comfortable working height for myself. So you're going to feel the bed raising up, okay? Have you been outside today? No? Well, it's a very nice day outside. Yeah. So, as you know, while you're raising the bed or lowering the bed, it's always like an awkward silence. So, even though this is a mannequin, I'm going to go ahead and make light conversation with the resident. Okay. So, now what I have next in line are my gloves. So, since I already have the bed raised to a comfortable working height, I'm going to go ahead and put on my gloves. The next item I have is my privacy blanket. So this is letting me know, okay, I need to do something with this blanket. So I'm going to go ahead and unfold the blanket. You do not want to fan flare it out, okay? Just lay it on the bed and unfold it. There we go. You want to make sure that it covers from the top of her chest down to over her feet. Okay? Okay, now that I have her covered with the privacy blanket, I'm going to go ahead and lower her top sheet, okay? And I'm just going to lower it down to her waist. But as I'm lowering the top sheet, I'm holding on to this privacy blanket because I do not want to overexpose her. Okay, so I have her sheet lowered to about hip level. What I'm going to do right now is overexpose her just so you can see, okay? You don't want to do this in testing. So I'm just going to lower her sheet so you can see where I have the top sheet lowered. It's just to hip level, okay? So now I'm going to cover her back up. Again, you do not want to do what I just did during testing. I only did this so you, the viewer, could have a better view of how low I lowered the top sheet. Okay. So now that I have the top sheet lowered, now it's time for me to remove the gown. Remember, this is one of 4 most common forgotten steps. So you can do this in one of 2 ways. Okay. You can either lift the resident up, and I'm just lifting her up. I have one hand on her shoulder blade, okay? And I'm going to lift her up. I'm going to use my opposite hand to hold the privacy blanket in place, and then I'm going to untie the gown. Okay, this is one way you can untie the gown. Or if you don't want to risk overexposing her, you can just, like, the strap is right here. So I'm not even lifting her up. I have the straps and I'm just untying them, okay, without lifting her up. Voila. Okay. Now, the next thing that I'm going to do is to remove her sleeve. Okay, because I'm working with her right arm, I'm going to go ahead and expose her right arm. To remove the sleeve, if I'm going to pick her arm up, you'll want to support both the wrist and elbow joints. And I'm going to show you how, okay? Just like this. So I'm going to bring her arm out so you can see. I'm supporting both underneath her wrist joint and underneath her elbow joint. And then I can go ahead and remove the gown. Okay, and once I get closer to her hand, I'm just going to place her arm down and remove it all the way. Okay, or after you expose her arm, you don't even have to lift her arm, right? Hold on to this privacy blanket and just move the gown down till you get it off of her hand. Okay, that way you won't, excuse me, risk not supporting her arm correctly or overexposing her. Okay, so now what I'm going to do is I'm going to move the gown all the way over to the other side, and I'll explain why I do this. Making sure I do not overexpose her. I'm going to go ahead and cover up this other arm. Now I'm going to walk on the other side to remove the sleeve of the gown from her left arm. All right, Mrs. Jones, I'm just going to remove the gown from your left arm. Again, I'm not picking up her arm, right? I'm just gently moving the sleeve down. Now, the reason why after I've removed the gown from the right arm, I pushed the gown all the way over to this side was because I didn't want to struggle when I have to like roll the gown up, right? So because the gown is all the way on this side, all I have to do now is just roll it up. I'm not going to risk the gown coming in contact with me or with my clothing. And as I'm rolling it in a ball, and now I can go immediately dispose of it into the soiled linen hamper. Okay, so I carried the gown away from the bedside at arm's length. My soiled linen hamper has a foot pedal, so I'm going to use my foot to open up the hamper and immediately dispose of the gown. So now what I'm going to do is place the linen protector, okay? So remember, you don't want to use the chucks as a linen protector. That's what the second towel is for. So like with the privacy blanket, I'm just going to unfold it without fan flaring it out, just lining it up right now. I'm going to place it underneath her head. Mrs. Jones, I'm just going to lift you up so I can place this towel underneath your head on the count of 3. 1, 2, 3. And I'm holding behind her shoulder. 1, 2, 3. Awesome job. There we go. You want to make sure that it gets on the other side, okay? And then the remainder of the cloth, I'm just going to expose her arm. I'm just exposing your arm, Mrs. Jones, to place the towel underneath your arm. I'm going to support your arm. There we go. And so now I have it. I'm going to show you how I have it. So it's underneath her head, coming out on the other side, and it's underneath her arm all the way down to her fingertips, okay? And now I'm just going to cover her back up, and now we can get started with giving her her bed bath. Okay, so if you see how I have my supplies, I have my soap in between the 4 washcloths, right? This way, it will give me a hint to let me know, do not put soap on this first washcloth, okay? If you do, wet the first washcloth that's used to clean the face and put soap on it. As soon as you get close to the face, the evaluator is going to stop you, and he or she is going to tell you to get a new washcloth. If this happens, that should let you know that you put soap on it, okay? Unfortunately, you still will not get credit for that step because the NAE had to make that correction, all right? So getting the first washcloth, I'm wetting it, I'm squeezing it out really good, right? Because I don't want to have water dripping. And I'm going to keep it folded into fours. I'm not going to put soap on it. And I'm going to hold it in a manner where the tail of the washcloth is not hanging. So all I did was make a diamond. I folded that diamond in half. I tucked in the tail, and now I have access, to all four open leaves. Okay, just like this. You don't want the tail hanging. Okay, so when cleaning the face, you have to start with the eyes. Okay, start with the eyes first. You're going to clean from the inner canthus to the outer canthus. And you're going to use a clean area of the washcloth with each stroke. Mrs. Jones, I'm just going to start by cleaning your face, starting with your eyes, okay? I'm going to clean your eye from inner canthus to outer canthus. Flip the washcloth over to a clean leaf. Clean the other eye from inner canthus to outer canthus. Flip the washcloth over to a clean leaf. I'm going to clean one side of your face. Flip the washcloth over to a clean leaf. Clean the other side of your face. And then I'm going to go to a closed end, okay, which I haven't used yet. Again, I'm going to fold my washcloth under so the tail won't be hanging. And for the closed end, I'm going to clean either side of the bridge of the nose. Mrs. Jones, I'm just cleaning one side of the bridge of your nose. I'm going to invert the washcloth to a clean area and clean the other side of the bridge of your nose. Okay, I'm going to hang this washcloth over the side of the basin, making sure it does not get into the water. And I'm going to take the towel to pat dry Mrs. Jones's face. Okay, again, this is the second most common forgotten step, is the drying of the face. Mrs. Jones, I'm just going to pat dry your face with the towel. There we go. Awesome. And now I'm going to place this towel on the overbed table. Okay, so now that I've cleaned her face, I'm going to go ahead and expose one arm. Now, if your scenario specifies which arm, make sure you're cleaning the correct arm. If it doesn't, you can choose which arm you want to choose, or not choose, but choose whichever arm you want to wash, or better yet, ask the resident, which arm would you like me to wash, okay? So, Mrs. Jones, would you like for me to wash your right arm or your left arm? Your right? Awesome. Okay. So what I'm going to do is go ahead and expose her right arm. My second washcloth, I'm going to wet. I'm going to open it up. And I'm going to apply soap all over the washcloth. Now, PROMETRIC is big on lather, okay? So you want to make sure that when you apply the lotion, that the washcloth gets lathered up like this, okay? So you can see the lather. Once I get it all lathered up, I'm going to squeeze it out a little bit more because I don't want to have water dripping all over the place. You can see the lather, the suds on my gloves. Okay, I'm going to start by cleaning. Where's my open leaves? Here we are. Behind each earlobe. Mrs. Jones, I'm just cleaning behind your ears and your other ear. There we go. I'm going to clean your neck. Awesome. And then I'm going to clean your chest, underneath your breast, your tummy, on both flanks. Okay, now what I'm going to do is expose her. Okay, so you can see exactly how I clean. Now, you're not going to do this in testing until the nurse aide evaluator asks you to lower the privacy blanket, okay? But right now I'm doing it so you can see exactly how I cleaned, right? So I cleaned behind both earlobes. I cleaned her neck. I cleaned her chest area. I cleaned underneath her breast, her tummy, and both flanks or the sides. Okay, that's exactly how I cleaned it. So I'm going to go ahead and cover her back up. When you do it, you're just going to raise the blanket. Okay, again, you're not going to overexpose her until the evaluator asks you to do so. Now I'm going to clean the right arm. So I'm just exposing her arm, and I'm going to start with the shoulder, cleaning her arm. I'm going to support underneath her wrist joint to clean each individual finger and fingernail, and in between the fingers, her palms, underneath her arm. And then, Mrs. Jones, I'm cleaning your armpit, okay, or your underarm, and make sure you get in the pit, okay? So now I'm going to cover that arm back up. I'm going to place this washcloth over the basin. I'm going to get my third washcloth. I'm going to wet it. Squeeze it out really good. I'm just going to keep it in fours because now I'm going to rinse the area I just washed. So I'm not putting any soap. Okay. And you don't have to worry about using a clean area of the washcloth for washing, rinsing the behind the earlobes, the necks, the torso, tummy, flanks, and the arm, hand, and underarm, or the back. Okay. Because it's assumed that the skin is intact. So now I'm just going to rinse, Mrs. Jones, behind your earlobes. There we go. And I'm going to rinse your chest area and your breast, your tummy, your sides. I'm going to expose your arm. I'm rinsing all areas of your arm. I'm going to rinse each individual finger and in between your finger and fingernails. The palm of your hand. There we go. And now I'm going to rinse your underarm. There we go. All right. Gonna cover her back up. I'm going to place this washcloth over the basin. And now I'm going to take the towel to dry the areas that I just washed. Mrs. Jones, I'm just going to dry behind your ears and your neck and your chest and tummy and your arm, okay? So I'm drying behind your earlobes. Gonna lift your privacy blanket up, and I'm pat drying, okay? So I'm pat drying all the areas that I just rinsed, making sure I do not overexpose her. There we go. Just going to expose your right arm. I'm going to dry your right arm. Support your underneath your wrist joint to dry in between your fingers and each individual finger and fingernail. And we mustn't forget the palm of your hand. Okay, just gonna support your arm. There we go. And now I'm going to dry under your arm or in your armpit. There we go. Awesome. I'm going to cover that arm back up, and I am going to place this towel on the overbed table. Now it's time to wash and rinse, excuse me, Mrs. Jones's back. All right, so because PROMETRIC does not emphasize the raising or lowering of side rails, before you turn the resident, you will not have to raise the side rail unless you want to do an extra unnecessary additional step, okay? So instead of raising the side rail, what you're going to do is move the resident closer towards you before turning, because what PROMETRIC is concerned with is making sure that, you know, after you turn the resident is not dangerously close to the edge of the bed. Okay. So Mrs. Jones, I'm going to go ahead and move you closer towards me. Okay. I'm just going to place a hand behind your shoulder blade, one on your hips, and on the count of three, we'll move. Okay. 1, 2, 3. moving her closer towards me. Okay. All right, Mrs. Jones, if you could raise your knee up for me, or as a matter of fact, to make sure you do not overexpose her, you can always pull the blanket closer, the privacy blanket closer towards you too, okay? So you won't overexpose her as you're turning her. Mrs. Jones, can you go ahead and raise your knee for me? Awesome. Okay, I'm just going to move the privacy blanket over a little bit. There we go. Okay, and you can give yourself a hug. Awesome. All right, and then on the count of 3, I'm going to turn you, okay? 1, 2, 3. Awesome. There we go. Make sure I do not overexpose you. All right. Okay. So if you're having difficulty turning the mannequin onto its side and having it remain on its side, usually the NAE will see that and they'll just come and hold the mannequin in place for you. But then you have some NAEs that won't do that. So all you have to do is just ask them, can you come hold the mannequin for me, okay? And that way you can work with both hands. So I'm just going to straighten out this privacy blanket. I'm going to go ahead and expose her back area only, okay? Just her back, making sure that the privacy blanket does not fall. I'm going to take my 4th washcloth. I'm going to wet it, squeeze it out really, really good. Open it up. Apply soap to all areas of the washcloth. Again, PROMETRIC is big on the lather, so you want to make sure that you produce suds, okay? A good lather. All right. So now I'm going to fold it in 4s. Again, as with the torso area and arm, you do not need to use a clean area of the washcloth with each stroke. What I'm going to do is just move the linen protector up underneath her back. And now I'm going to clean the back of her neck and her back. Now I'm just using a circular motion. Okay. Now I'm going to place this, washcloth over the basin. I'm holding her now because she's starting to fall. Let's see. Yay! Okay, she's holding herself up. So now I can use both hands again. This 5th washcloth, I'm just wetting it, not putting soap on it. I'm leaving it in 4s. And the area I just washed, I'm going to rinse. So I'm rinsing the back of her neck and her back. All right, Mrs. Jones, I think I got that all rinsed off for you. I'm going to now place this washcloth over the basin. If you like, you can use the towel that you use as the linen protector to dry her back, or you can use the towel that you use to dry the face and the arm and the torso and tummy, okay? Mrs. Jones, I'm just going to pat dry the back of your neck and your back. There we go. Okay. All right. Okay, now that I have the back dried, I'm now going to apply lotion to my hands and I'm going to rub it together to warm up the lotion. And now I'm going to give Mrs. Jones a back rub. You're going to do 3 passes with your hands moving from the sacral area in a circular motion up towards the shoulders. Okay, so it's going to look like this. 1, 2, and 3. Okay, I'm just going to move this table out the way. And now I'm going to give her a back rub. 1, 2, and 3. All right. Now I'm going to take my towel and I'm going to pat off any excess lotion. There we go. Now, the 4th most forgotten step is the removal of the linen protector. So while I still have Mrs. Jones on her side, I'm going to go ahead and remove the linen protector, okay, and place it on the overbed table. And now I'm going to turn her back onto her back. Mrs. Jones, I'm just going to turn you back on your back on the count of 3, okay? 1, 2, 3. There we go, making sure I do not overexpose you. You are doing so well. Just going to get you back in the middle of the bed. Straighten out your legs. There we go. All right. Okay, so we are done with the complete bed bath. We are done with the back rub. Now the only thing left to do is to put her on a clean gown and dispose of all of our linen, and put everything else away. All right, so the easiest way to put on the gown without risking overexposure is to place the gown on top of the privacy blanket. Again, I'm not going to shake the gown open. I'm just going to unfold it. All right. Placing it over the privacy blanket like so. I'm going to expose her right arm. There we go. And of course, because I'm explaining to you, I'm really not doing a lot of talking to the mannequin. But what you do, you need to make sure everything you do, you say it, okay? You verbalize it to the mannequin, or if you're performing a skill on a live person, okay? You verbalize everything that you're doing and communicate with the person. What I'm doing is I'm placing my arm in the sleeve, and then I'm going to support both her wrists, underneath her wrist joint and elbow joint. And I'm just going to place her arm in the sleeve like so. And then I'm going to do the same on the other side. All right, Mrs. Jones, I'm just going to place your arm in this sleeve. I'm just exposing your left arm. Just placing my hand inside the sleeve. And placing your hand in it. And then moving it up. Now you can, when you tie the gown again, you can lift her up to tie the gown, or you can just bring the straps to the back like I'm doing and tie it up. Okay, that way you won't risk overexposing her. All right, Mrs. Jones, I have your gown tied in the back. Now I'm just going to remove your privacy blanket and pull up your top sheet. Then pull your gown down, pull up your top sheet. There we go. Get you all nice and comfy. Okay. I'm going to roll up the privacy blanket. Again, I'm rolling it up in a ball, and I'm going to walk it over to the soiled linen hamper to dispose of it. Okay, now I can go ahead and close everything out. Okay, I'm going to dispose of all of my soiled linen. I'm going to empty, rinse, and dry the basin, and then store it back into the storage area wherever I got it, along with the soap and the lotion. Okay, now I'm just collecting all of my soiled linen. Holding it at arm's length, I'm going to dispose of it into the soiled linen hamper. Since I'm at the sink, I'm going to empty the contents of the basin into the sink. You do not need to empty this into the toilet. It has not contained any bodily fluids. Okay, so please empty it in the sink. I'm going to rinse, and I'm going to empty the rinse into the sink, and then I am going to dry the basin. I'm going to dry it on the inside really good and on the outside. And you want to make sure that you have it completely dried, because there are some NAEs that will check to make sure that there's no water in the basin, okay, or that it's not wet, okay. I'm going to dispose of this paper towel in the waste bin, and then I'm going to head back over to the bedside. All right, Mrs. Jones, I'm just finishing putting away everything. I'm just restoring the basin soap and the lotion. I'm going to go ahead and remove my clean barrier. Now, for your clean barrier, you can either use a Chucks pad or a towel. If you use a Chucks pad, make sure you dispose of it into the waste bin. If you use a towel, make sure you dispose of that towel into the soiled linen hamper. Okay, at this time, I'm going to remove my gloves without contaminating myself. So I'm making a C, pulling it from the middle of my palm, balling it up into a ball. Doesn't matter how many fingers you use. You can use 1, 2, or 3. I normally just use 2. Going underneath the second glove, pulling it over and disposing of it, and then immediately verbalize washing hands. Okay, at this time, I'm just going to go ahead and replace the overbed table where I got it from. I'm going to lower the level of the bed. Mrs. Jones, I'm just going to lower the level of the bed to make sure it's a safe level for you. I'm going to get you covered up here. There we go. Make sure you're nice and comfy. Okay, bed is now in a low safe position. Bed wheels are locked. I'm going to go ahead and give you your call light in your hand. Would you like for me to keep the privacy curtain open, or would you like for me to close it up? You want to keep it like this? All right, Mrs. Jones. Is there anything else I can do for you, Mrs. Jones, before I leave? Okay. All right. Well, you have your call light here if you need me for anything, okay? All right, Mrs. Jones, you have a good day. Now I'm going to verbalize washing my hands. Skill complete. Yay, we did it. I hope you all enjoyed this video. See y'all later. Ciao.